Hey nursing geeks, it's Jay. I'm a nursing student from Mercy College of Ohio, as most of you guys know. This is take 2 of the wet to dry dressing change. So just as a disclaimer as always, I am just a nursing student. I am not a licensed nurse. So please take everything with a grain of salt. I'm just following the step-by-step procedures. So follow along with me and make sure I don't miss anything because I might. Alright? Alright, so before we begin, a few key things to note is I'm not wearing my stethoscope. I'm also not wearing a watch. So make sure you note the time before the skill starts and wear your watch to it because it's part of your uniform. Take it off as soon as right before you take the skill because you don't want something on your hand and you don't want your stethoscope or your badge. My badge is clipped down here. It's still above my waist, so it's still a thin uniform, but I don't want it up here, so to limit the chance of me breaking sterile. So no stethoscope, badge down here, no watch to make sure that you don't break sterile accidentally up here. So that's a good thing to note. Also try to start your tape beforehand, so find the start of your tape and bend the top part down so that way you're not fumbling trying to figure out your tape before you start the skill. So yeah, just a few J tips and tricks. Hello, Mr. Smith. My name's Jonathan. You can call me Jay. I'm a student nurse from Mercy College of Ohio. So first things first, I'd go ahead and check the medical orders. Make sure that Mr. Smith does have a wet to dry dressing change ordered for him. He does. So I'm going to wash my hands as I'm walking in. Alright, Mr. Smith, can you tell me your name and date of birth, please? Alrighty. So I'm checking. Alright, that is correct. Thank you. Alright, Mr. Smith, I'm going to be performing a wet to dry dressing change on you. This will make sure that we get the dressings changed so that we can have the optimum environment for your wound to heal properly, so we can monitor its healing. Is that alright with you? Alright, you can help me with this procedure by just lying flat, keeping your arms away from the incision, okay? Alright, do you have any questions for me? Okay, so can you tell me what your current, on a scale of 1 to 10, how would you rate your pain right now? Alright, so I medicate 30 minutes prior to the dressing change. And alright, Mr. Smith, I'm going to go gather my supplies and I'll be right back. Right, so I'm back. So I gathered my supplies right over here. So, enter the room, wash my hands again. So now I'm going to go ahead, get Mr. Smith up to a comfortable height, get my table set up. So I'm going to go ahead and don clean gloves. Then I'm going to clean my surface with a antibacterial wipes. Alright. Ready? Gonna get my table nice and set up here, raise it, put it a little bit more over the bed, but I can't do that right now. I also want to make sure my trash can is within reach. Alright, so for this part, I just like to get my solution out because it makes it a lot easier to do the bath basin. Right. I'll also need my biohazard bag. I need a pair of cotton-tip applicators, my lab culture thing, and that's not it, my ruler, which I'm just using this because I misplaced my other one. Right, so then I'm just going to get this other stuff out of the way because I don't need it right now. Right, so lift the bed to a comfortable position for me. Position Mr. Smith comfortably. Are you comfortable right there, Mr. Smith? He says yes. Get my things there, all ready to go, and I'm going to drape my patient. So the wound's visible. Alright. Right, so I do want to cover him as much as possible, but I also want to leave enough room for my sterile field so I don't accidentally break it. Right? Self-correction. When I wiped off with antibacterial wipes, I would have removed my gloves and wash my hands first. Right, then got all my supplies and set up. So now I'm going to don new clean gloves. Alrighty. Now I'm setting up my biohazard bag at the end of the bed right here. Alright. So now starting with the first layer, I'm going to peel up on the tape, pushing down against the skin, opening, peeling the tape towards the center of the wound. One dressing at a time. Alright, I can see, if you guys can see, I'm not sure, I use a little bit of highlighter. This is going to be Ceres because there's just a light yellow, and it's clear drainage, light yellow to clear drainage, and it's a scant amount, so there's 4 levels. It's scant, mild, moderate, and what was the last one? Saturated, that's the last one. So it's scant, mild, moderate, and saturated. Saturated's the most, scant is the least amount. Alright, so it's a scant amount, it's very, very little. Alright, now I'm going to take this, next dressing off one at a time. Right, both of these are, I think this is a mild amount of drainage right here. They're both red, pink, and yellow, so it's just a little bit, so I know it's serosanguinous. It's not drenched and it's not completely red, so I'd say that these are serosanguinous. Then I'm not going to contaminate the edges of the wound bed here. Right, so this would be sanguinous, and I would call this a moderate amount. Right, so now I'm going to look at the wound, going to assess. So I see there is some erythema, which is reddening of the skin around the reddening of the skin, and erythema around the edges of the wound. So all around it, and the peri area of the wound. You can see deep on the bottom is striated, and which is little lines, and up towards the top is granulated. So there's little dots. It will be different per wound, but that's, if you get the worst one, you're going to see it. So, and then I see some eschar, which is the black and necrotic tissue inside of the wound. So it's necrotic if it's like the outside, so like a fingertip could be necrotic, but the inside of a wound, if it's inside the skin, that would be called eschar. So, and I do see some slough, which is some drained, thick yellow lines in there. It's just like dead tissue and dead, like, bleh in there. So I do see some slough there. Alright, so now I'm going to go ahead and the edges are well approximated. I'm going to go ahead and measure the wound. So I am checking for undermining. Undermining will be around the top. Right, I don't see any undermining. I don't see any tunneling. Right, so I'm going to measure the wound. It's about 3 centimeters depth. Say that's about 22 centimeters, so I made that way too big. And in width, it's about 3 3/4 of a centimeter. Right. So then I would irrigate the wound prior to obtaining a lab culture. So take it out the first biohazard bag right here. Right. So from top to bottom. Whoop, I just broke my lab culture. That's not good. Right, make sure I get some good in there without contaminating the outside. Right, I'm going to crinkle the bottom in order to activate the inside of it. To activate the agent, put it in the biohazard bag, label it, date it, all the pertinent information. I'll send this off to lab. Right, so now I'm going to dispose of my biohazard bag and change my gloves, wash my hands. Right, now I'm going to go ahead and set up the rest of my supplies for the dressing change. So I'm going to have my Kerlix 4x4's abdominal pad, my solution that I'm going to be using to irrigate doctor ordered solution, my sterile gloves, and my two sterile contact applicators, and my tape. What I like to do is fold my tape over so it's an easy, I can grab it and go. So I'm going to set it up the way I like. Alright, first thing I'm going to do, tape my con-tip applicators to the side of my table. Right, you can do it like that. I'm not sure why you did it like that. I usually do it the other way where I open it first and tape it, but as long as you maintain sterility, you can do it either way. Right. In fact, I'm just gonna actually fix that right like that. Right. So now, I'm going to open my Kerlix fluff. Alrighty. I'm gonna get my tape out of my way, right over there. Now I'm going to check my solution, make sure it's the doctor order solution. Make sure the date it hasn't been expired, it's not expired, the expiration date. Make sure it's been within 24 hours. Set the solution, check the clarity of the solution, make sure there's no floaties or any debris, and make sure it's clear. And find the label, palm the label. So now I'm going to go over my trash can, I'm going to lip it, make sure it's above my waist. Right, I lipped it. So now I'm going over. Right, step back without breaking sterility, keep my eyes on my sterile field. Gonna get that solution away. Now I'm gonna open up the rest of my packages. First thing, I'm gonna do my 4x4s. If that happens, don't panic, because you have not broke sterile. You still have the 2-inch border, that 1-inch border around. So simply just reopen. Hold it. Go back. Don't freak out. A lot of people freak out like, oh, I screwed up. You didn't screw up. That happens all the time. So just remember to stay calm. You don't have to call a sterile break, because that is not a sterile break. If it falls on the floor, it's a sterile break. But if you feel safe to call a sterile break, you can, but if you think you did, but that's usually not one. Right, so now I opened all my sterile packages. Now I'm going to open my sterile gloves. Here it comes to the end of the table. I'm going to start prepping my Curlex. Alright, so I'm going to, personally, I like to have it pretty thin. You don't want to make it super thin because that defeats the purpose of fluff, but like to get all the way out, unfold it all the way that it can be. We'll make it longer, but make it a little less thick in the middle. So what I learned today, so you can get it about like this, like we know that, but you can actually go one step further and make this, it's kind of hard to do, but you can actually unfold this a little bit more. Make sure it doesn't drop below your waist, because that would be serial break, and you'd have to say that if it dropped below your waist. And kind of messy, but you can see that now that's even longer. Curlex is not my favorite substance in the world, but after this checkoff, I asked one of the nursing instructors, and she's just like, yeah, this checkoff is the worst checkoff after it's smooth selling when it comes to checkoffs, for the most part. Alright, so now I'm going to start twisting and curling. Remember, we're not twisting too tight, but we're doing it good enough so that we know we can get in. Alright, so as you can see, this is all, there's no big, super bulky places in the middle like we could see in the, like, normal, so, like other people do, and if you like that bulky stuff in the middle, you do you, but personally I don't like bulky stuff. So now I'm going to wet my Contip applicator. Oh, that was close, I almost reached over that. But wet your Contip applicator. Now, this would be over my bed so I could see in my peripheral vision. I can still see the sterile field in my peripheral vision, but just want to make sure you do that for checkoff. So now I'm going to start packing my wound. You can do lasagna method. You can do the poke and jab method. I'm not sure what it's called, but that's what I call it. Whoa. Alright, sterile break right there. Try to drop my Curlex. Another sterile break right there. Alright. So now, can't get to my trash can, so just dropping my Contip applicator. Right now, keeping my eye on both fields. Taking my 4x4s. Drop. Placing my ABD there. Sterile part of this procedure is now over. So now, my gloves are now clean gloves. So I'm going to go ahead window pane my dressing. So window pane. Now that I window paned, I'm going to go ahead properly dispose of all my equipment. So throw all this, the wrappers and everything in the trash can. Pick that Contip applicator that's on the ground. Throw that away. Now I don't want to forget. Alright, so now after I disposed of all my supplies, take my gloves off. Going to wash my hands. Then I'm going to take a piece of tape. I'm going to write my initials, so JS. I'm going to write the time, right? The time of the procedure and what today's date is. Stick down the wound. Do not write on your patient, write on the table, and then stick the piece of tape on your patient. Right, so then I'm gonna cover up Mr. Smith. Right, how was that procedure for you, Mr. Smith? Good, do you have any pain with that? Any discomfort? Lower the head of the bed, or lower the bed. Right, bed is lowered. Now I'm gonna make sure making sure it's locked. Make sure both two side rails on the top are are up. The two in the middle are lowered. So just the front two. Alright, Mr. Smith, your call bell is here. And right over here, let me know if you need anything. And now I'm going to wash my hands and going to document my findings. So I'm going to document what the wound looked like. So the appearance and measurements of the wound. I'm going to document the drainage, so the color, consistency, amount, and odor of the drainage. I'm going to note what solution I used for irrigation and for the packing. I'm also going to note what dressings I used, so the 4x4s, the abdominal pad, and Curlex. I'm going to note the time of the procedure, how the patient tolerated the procedure, and that I obtained a lab culture and sent it off to lab. So wash my hands, document those things, and my skill is complete. So let me know if you guys have any questions. I'll go through my video, make sure that I didn't miss anything. I might have. So just remember, you have 3 dresses. You can break sterility 3 times. I broke it 3 times there. That was my first time trying the football. But it will be a lot easier in person because you'll have the bed and you have an actual mannequin. Sometimes that's a little bit harder, but you guys got this. Believe in yourselves. You got it.